Now some of them and other health workers in the community say they're not ready for what could lie ahead as coronavirus numbers increase.
The truth is we are going into this crisis ill-prepared. Even at this stage, it's only a minority of people who have been trained. And ambulance workers who have been trained have not been issued with a full set of protective equipment that they should have been. They've not got goggles, they've not got masks, and they've not got the suits that they should be wearing.
In response, the First Minister says they will get what they need.
From the General Secretary of the GMB Trade Union in Scotland, Gary Smith. Good afternoon, Gary Smith.
Good afternoon.
Now, you're concerned still about the situation care workers are in with regard to protective equipment, aren't you?
It's more than protective equipment, it's also the lack of proper and adequate testing for care workers. But I did write to the First Minister in mid-March saying we needed a comprehensive plan for care, including the public and private sector. And that could have and should have dealt with PPE, but it should have also dealt with testing for the residents of care homes and for those who were coming out of hospitals. And it should have dealt with the issue of having a systematic, regular testing regime for care workers. And that testing regime is still absent.
Gary Smith is the General Secretary of the GMB Union in Scotland. Good morning to you, Gary.
Good morning.
What are you being told by your members?
Well, I think it's now quite clear that people are being released from hospital without being tested and put into care homes. We have a crisis within a crisis in our care sector, and I think we need to understand that who made the decision about what are the numbers involved and who made the decision to lump together, quite frankly, the most frail and elderly in our society with people who are low paid and often unprepared to properly deal with them.
Can I just get this absolutely clear? You believe that patients are being released without being tested to show that they have recovered?
Our understanding is that people are being released from hospital and they are being put into care homes, and the care homes and care home staff are not sure whether those people are COVID positive or not. And if we read some of the press reports for the weekend, it is frightening what's happening. We seem to have some of the elderly and most vulnerable people being put into care homes without proper testing, and in turn we know that we have had a long-term problem in care. The Scottish Government has identified in their Fair Work report that there was long-term problems within care, and over a month ago I wrote to the First Minister saying we need a national care plan. We are lumping together elderly, frail people without knowing whether they're COVID positive with workers in care who are often unequipped and untrained to deal with these situations.
One trade union has accused the Scottish Government of failing to protect the care sector.
It is an absolute scandal that people have been discharged from hospital into care homes without being tested, and that the workers in the sector are not being systematically tested. Those people are terrified. They're worried about their own health, sure, but they also care passionately about the people that they look after.
The virus has reached almost half of Scotland's care homes, with 2,000 suspected cases. So was the Scottish Government too slow to respond to the threat?
Tonight on Drive Time, the Scottish care home system faces collapse. We can reveal shocking claims from a union in Scotland that a high proportion of care home staff are harbouring the virus but not displaying symptoms. I spoke to Gary Smith, the Secretary of the GMB Union.
The evidence that we're starting to see is that 30, 40 and more percent, 30 and 40% and more of care workers in private care homes, when they're being tested, have no symptoms, but they are COVID-19 positive.
Can we just let that sink in a second? This is 30, 40% or more of staff in care homes in Scotland currently testing positive for the virus, but not displaying symptoms. That's the claim. GMB Scotland says the care home sector could face collapse, and Drive Time has also heard that care home workers, you have to listen to this, they're scared to get tested because they don't want to lose pay.
The vast majority of care home workers are women. They work for the minimum wage or a little above, and they are terrified at the prospect of being tested because they will get sent home and they will be on statutory sick pay, and these workers cannot afford not to be working.
Trust me, you have to hear this interview. We will be addressing this issue throughout this whole programme.
The GMB union says it has evidence that in some care homes, more than 30% of staff are testing positive for Covid-19, even though they don't have symptoms. The union has renewed calls for regular testing in all care homes, not just those where there's been a case of coronavirus.
The GMB union has described this as very worrying. It wants to see a higher number of care home staff tested, including those in homes where there hasn't been a confirmed case of COVID. And as you mentioned, the union says it's seen evidence that in some care homes, more than 30% of staff who aren't showing symptoms are testing positive.
What's happening in terms of testing is that there's a postcode lottery. Some areas of the country there is regular systematic testing, or there's better testing now. In other areas it's still poor. And we are deeply concerned that there are very significant numbers of care home staff who are testing positive for COVID-19 but who have no symptoms.
Now, Scottish Care, the body which represents the independent care sector, says that it doesn't recognise that 30% figure.